What's up, everybody? I hope you're doing well. Today we're going to talk about this question of like, do we need to have breakthroughs regularly in therapy? Do we need to have breakthroughs in therapy in general? Is that part of effective therapy? Why do we have so much pressure to have breakthroughs as therapists? We're going to get into this a little bit today, and the main reason why I'm getting into this today is because it came up kind of offhandedly in last week's episode where I was talking about how I prepare for sessions. And I made this reference in that episode where one big learning for me was realizing that not every session has to have a big breakthrough, and that makes it a lot easier and less anxiety provoking for me to prepare for sessions. And some of you commented in the episode about that. One person says, "I love how you said that it's unrealistic to have a breakthrough every session. That really spoke to me." Oh, I'm so glad. And then somebody replies to that comment and they say, "I agree. I think this topic could be a whole video." So here's that video. It's happening now. I am recording from home today because, I have an anxious dog. And part of our fence is getting replaced today. She's currently panting heavily under the desk that the tripod that my camera is sitting on. Anyway, so I'm at home to attend to her. I actually, for those who are watching and not just listening, you can see, my cats in the background are concerned for my dog's well-being, and so they are hanging out in this room to make sure she's doing okay, and I am at home. We're gonna work from home today. Listen, there's just gonna be one extended, minimally edited episode this week because, got anxious doggo at home, as mentioned. Fence is getting replaced, so it's good to be on hand. And it's the first week of school for my kiddos, which fellow, millennials out there, do you remember when we started school after Labor Day? Like, what happened to that? Anyway, school starts August 11th out here, at least. You might hear some noises in the background, my dog panting, fences being cut down and stuff. We're gonna make it work today. I actually feel great. It's delightful that I can just pivot like this. I was intrigued that I wasn't like the only one who's ever felt that pressure to have a breakthrough every session. And I thought I would just kind of like casually put my feelers out, post a poll on Instagram and ask you all about, do you experience this pressure to have a breakthrough in session, and how much of that pressure do you feel? And I was so surprised how many of you engaged with my poll, like probably record-breaking levels or close to it. I didn't do the exact math, but over 230 people voted in this poll. And in this poll, I asked the question, how much pressure do you feel to have a big breakthrough moment with clients in sessions? I did a multiple choice poll where I gave 4 options. The 4 options I listed were a lot of pressure, moderate pressure, a little pressure, and no pressure. And I find the results fascinating. So let's start there. 17% of people who responded, that's 42 people, said a lot of pressure that they feel to have breakthroughs in client sessions. So it's only 17%, but they're feeling a lot of pressure. So that's a big number of people to say, yes, it's a lot of pressure. And then with the most votes, 101 votes, 42% of people who responded said they feel moderate pressure to have breakthroughs in session. 27% of people who voted responded a little pressure to have breakthroughs, and 14% of people who responded said they feel no pressure to have those breakthroughs, which at this point in my career, I am squarely in the no pressure camp. So I have progressed from feeling a lot of pressure to have breakthroughs with clients, and over time, over years, arriving at a point of like, I feel absolutely no pressure to have breakthroughs with my clients. This feels important to talk about, that only 14% of people say they have no pressure to have breakthroughs with clients. That's, let's do some math, 86% of people who responded to this poll have somewhere between a little pressure and a lot of pressure to have breakthroughs. So let's get to know this a little better. Like, what is this? Does this matter to have breakthroughs? Is it realistic to have breakthroughs in session? What is a breakthrough? Let's, I want to get into it. First, let's talk about what even is a breakthrough in therapy. And as I started searching for it, it's one of those things that doesn't really have a clear definition. It's not even really talked about that much. There's not research articles talking about breakthroughs in therapy. The research articles are measuring, outcomes on symptoms that clients are experiencing. Are they experiencing overall, betterment of their daily life experiences, and breakthroughs don't necessarily speak to that. So it's fascinating to think, like, how do we even define a breakthrough? So let's piece together a few different bits of information I found on the internet. One is from inkblottherapy.com. I will link to anything I reference below so you can follow along if you wish. The title of the article is "What Does Having a Breakthrough in Therapy Mean?" And then lower down, there's a headline that says, "What is a breakthrough in therapy?" So let's read what they say. Quote, "The term breakthrough is used in therapy circles to illustrate the concept of a patient coming to a sudden or abrupt realization that will help them on their path to healing. Examples of therapy breakthroughs may include discovering the root of addictive behaviors, uncovering a traumatic childhood memory, or releasing a fear that had been holding a patient back in life." That's kind of how I imagine breakthrough when I think of what a breakthrough looks like a big aha moment, like putting two big puzzle pieces together, like, oh my gosh, like this is why I always react in these rageful ways towards my partner. It's because of this thing from my past, like that sort of aha, insight developing moment. This article continues on with some commentary that aligns with some of my perspectives, so I'm going to keep reading a little bit further. Quote, "While a breakthrough in therapy may feel like the end goal, it is essential to understand that there are many layers to a mental health journey, and not all can or will end in what's popularized as a, quote, breakthrough. Working with a therapist can be an effective tool for coping with mental health concerns or helping unconscious psychological issues come to the surface. Seeing the results of your hard work will take time." When we emphasize having a breakthrough in therapy, like these huge aha moments, and kind of almost hold it on the pedestal as though the breakthrough is the goal, is the end game, then we de-emphasize, like, what is this client's presenting concerns? What are their desired outcomes for their life once therapy is completed? And it's not totally clear that these epic aha moments necessarily contribute to improvements towards their end goals. So like referencing that example I gave before, if let's say I'm expressing a lot of rage towards my partner in destructive ways, and I have this aha moment where I realize, oh my gosh, this is where it comes from this childhood experience, that may or may not have any bearing on how much or little I continue to have those destructive expressions of my rage. For some people, I think the breakthrough will be a very helpful, like, motivator, connection point. When we can make sense of things, it helps us know how to move forward. But the breakthrough itself is probably not going to be enough to change the outcome, to change our behaviors. Is that a hot take? I don't know. Interestingly, I wasn't able to find much research on this phenomenon. So like if you are familiar with research available that is about like how much breakthroughs like this correspond to positive patient outcomes, client outcomes, I'd love for you to reference it below so that I can learn, and of course others can too. I am definitely hearing fence making noises in the background, so I apologize if you can hear them too. I feel pretty confident you can. And to just round out our idea of what a breakthrough is, I also turned to Reddit. The subreddit Talk Therapy has a post from 5 years ago titled, "What do you consider a breakthrough in therapy?" And the poster says, "Is it a big ha-ha moment or something small? Do you know when it happens? Does the therapist know when it happens? Does anything change? Any examples?" And interestingly, the most upvoted response, which isn't, I assume isn't from a therapist, but from, somebody who's just seen a therapist, really captures my perspective well. They say, quote, "I imagine breakthrough is a very personal thing and not something with a single definition, a bit like love, but I'll answer from my perspective and share a few examples in case it helps. I don't think any have ever happened in therapy like a light bulb moment." I think they're talking about their own experiences. "The filament might be activated in therapy, but it's not fully illuminated until I get home on my own and keep processing it. To me, it feels like the metaphor I use to myself when I think of my life as multiple strands of thread, all different colors, mostly a massive jumble and a lot of knots. A breakthrough for me is when I have untied a significant amount of knots in one thread and can lay it flat and straight. Or when I can tie 2 or 3 separate strands together in a neat bow and see exactly how they connect up. Also, a lot of mine have come in the form of finally feeling in my soul or my gut something I have known intellectually for a long time. It's like a click. All these things change things in a slow burn way. not a big dramatic way like I had hoped. Ha! Like, oh, suddenly I don't feel this or that, or never do that annoying behavior I wish I could stop. But I've given up on changing those things I want to fix or disappear about myself and focus now on just accepting and understanding. And then if change happens, happy days, but if not, no disappointment. I've been on this merry-go-round long enough to know that clinging on for a specific outcome or something to be fixed is usually a bit of a letdown. At least now I can recognize things quicker and contextualize them and treat myself kindly rather than judging myself. Yeah, that sounds delightful. And I'll just read the beginning of the second most upvoted comment on this post. Quote, "It might not sound very exciting, but my big breakthrough moment was realizing that there is no big breakthrough moment where things completely change and you're fixed. There's no single piece of the puzzle you're missing that will suddenly cause the big picture to make sense. Therapy and healing is pretty much doing the same thing over and over again until you've integrated all your pain, negative beliefs, abandonment pain, trauma, or whatever else you suffer from, etc." So do our clients understand the therapy process a little bit better than us? It's fascinating how much pressure we can feel to do something that our clients might not even expect from us. I mean, some of our clients definitely do. We'll get into that. But I think a lot of our clients really understand that they're not going to like show up twice and then have this massive aha moment and suddenly like poof, they're all better. And of course we know that too. We know that they're not going to come a few times and just magically whatever was bothering them is totally resolved. But based on your responses to this poll, we're clearly feeling a lot of pressure to offer these breakthrough moments to our clients. So to kind of help fill in some of the blanks for me, because I was honestly a little bit surprised to see just how many folks feel pressure to have these breakthrough moments in session, I posted an additional question to Instagram and asked, "I'm curious, where do you think the pressure to have breakthroughs comes from?" And 40 of you responded, thank you, which I know is not a simple question to just reflect on and answer in a tiny box. And I compiled all of your responses and loosely categorized them. And I should have known what the most often referred to response would be, because this tends to be the most often referred to response for like any question I end up asking in a poll on Instagram. But the top source of pressure to have constant breakthroughs in therapies that folks cited was money. 14 different people answered in some way that referenced like, therapy is expensive, so I feel pressure to help my client have a breakthrough. Let me read just a couple of examples in this category. Someone says, "From the fact that clients are sacrificially paying for our service and our suffering." Someone else says, "Want to make what the client is paying for feel worth it." Someone else says, "Wanting it to feel like they're getting their money's worth." And I feel like this wording like really drives this point home, but someone says, "Not wanting to, quote, waste clients' money or time." Ooh, yeah, of course we don't want to waste their money or time. But it's interesting to me, okay, Marie's commentary. Of course we want therapy to be worth our clients' money. It is so expensive, we know. As I'm thinking through this topic in general, I have these kind of two thoughts popping up. One is it's at least a Marie-held belief, but is it not an evidence-based belief that in general, in life, anything that we have to work towards, that we have to learn, that we have to change, not just about our mental well-being, like takes a lot of time and may have minimal breakthroughs, or maybe another way of putting it is like breakthroughs may have little to no impacts on like how successful we are at arriving at those goals. Like let's say you want to learn how to run a marathon. Like you're probably, I don't know, are you going to have breakthroughs while you're training for a marathon if you've never run a marathon before? Maybe. I don't know. Marathon runners, tell me in the comments. But I feel like whether you have a breakthrough moment or not, like still ultimately you have to keep putting one foot in front of the other, slowly building your stamina, your training, your ability to go for so long. And push your body that far that you just have to do it slowly, little by training over a long time and putting in a lot of work. And there may not be like a giant breakthrough on week 2 of training for a marathon where suddenly you're like, oh my gosh, now that I realize this thing, I can totally just run a marathon. Like that's just unrealistic. Now, I do have some thoughts about exceptions to this idea. There are times where breakthroughs just like totally happen. I'll get to those in a little bit. But the other thought I have on the flip side is like, despite what I just said, and I think most people logically know that like you just have to work at something one step at a time for a long time to get to any sort of meaningful change. Like we live in a culture where we want instant change. Like we see, I don't know about you, but like any ads I see on my computer, it's about like some crash diet to, you know, lose the weight in this much time. Anyway, that's a hot mess. We're not even going to get into body image. But like crash diets don't work. Like regardless of your stance there, like crash diets don't work. You know, crash anything doesn't work. Like this one trick like revolutionized my productivity. And it's like, okay, you're trying to sell me something, but like probably that one trick isn't going to take me from like can't get off the couch and get anything done to like suddenly, you know, getting all my tasks done for the day. So I think societally we have this like, we've glamorized the idea of instant change. And so I could totally see a scenario where whether we've internalized it ourselves as therapists or we feel this pressure from this society externally, we feel like we need to help people deliver instant results, even though scientifically most of the time things don't work like that. If you go to see a physical therapist because you have an injury, it's probably not because like they just, you know, told you to do this exercise this one certain way that magically your injury gets healed. It's like, no, just keep very gently doing the same exercise over and over again and building on it little by little by little until your injury has healed. I'm getting worked up about this, y'all. Why does this bug me so much? Okay, clearly, who knows? Maybe I can go to therapy and have a breakthrough and learn about why this is bothering me. Carrying on with your responses to this poll. The second most commonly offered response for why people feel pressure to have breakthroughs with their clients was media. And of course, as soon as I saw that, I thought, that makes sense. But as a chronically not online person, as somebody who is only on social media if I'm posting for my business and then I don't scroll, I avoid algorithms. I know you can't avoid them. And I watch almost no movies and very few shows. I do watch YouTube. That is my kryptonite. But I don't often see how therapy is represented in media until you all tell me about it, and then I go look it up and I'm like, what is this? So let's read some responses that y'all said in this category of media. One person says how therapy is represented in media. Someone else says TV shows. Someone else says media, shows and movies. Someone says when therapy is represented in movies, there's often major breakthrough moments. And somebody also references social media. So I'm wondering what social media is also doing to talk about breakthroughs. Okay, this is a good opening for one of the thoughts that I want to share. This idea of like, do breakthroughs happen in therapy? How realistic is it to have breakthroughs? How helpful is it to have breakthroughs? It has to be tailored to the individual. And some individuals are going to be primed for breakthrough in a position where they are just ready for breakthrough. Like, give me the breakthrough, I'm ready, tell me. And then when it's delivered, like they catch it and they run with it and they make the changes, or, you know, whatever outcomes they're looking for, they happen swiftly and easily. That's not going to be most people from my experience, but it certainly happens. But for other people, they're not in a position where they're primed for breakthrough. It's like a very slow, gradual, like undoing of a lot of knots. Like actually how that Reddit poster was talking about earlier, like just very slowly parsing out these knots. For a lot of folks, they're going to be more in that position where they've spent so long thinking about things a certain way or living their life a certain way, habituating certain destructive behaviors, like whatever it might be, that you can't just with one breakthrough undo all of it. Even just sharing a little bit from my experience, like I can cite a breakthrough experience in my own therapeutic history, and I can cite a very long drawn out, not breakthrough at all experience. Like I've shared before that in high school, I had very severe panic disorder. When I was trying to figure out what was going on, I thought, these were my words as a 14-year-old, I thought I was crazy. I thought nobody else on the planet had ever experienced what I was going through. I thought maybe I was actually physically dying. I did not know that there was a mental health diagnosis called panic disorder that's actually rather common enough so that there are researched treatment plans that are effective. And when I discovered that there is something called panic disorder, and that's what I'm experiencing, and if I walk through these steps, like I can feel better and stop having these panic attacks, like that was a breakthrough moment for me. And even then, it was still like 2 years of walking through systematic desensitization before I was really free of that kind of disordered way of experiencing the world. But that was that breakthrough was everything I needed to say, okay, tell me what to do. What's systematic desensitization? Where do I start? Let's go, buckle up, we're doing it. And I did it. And in the sense of like being motivated to make the change, it was easy for me once I had the breakthrough of like understanding the diagnosis and the treatment that was like researched. But then fast forward to a totally different life situation 10 years ago, I really started, I guess, unraveling my relationship with my parents and understanding just how narcissistic my mom was. And even that, like, I went to weekly therapy for 2 years specifically talking about that. I put my relationship on pause with my parents for 6 months trying to figure out what to do about that relationship because I could not figure it out. I had 0 breakthrough moments related to that relationship. All of it just felt like a heavy trod through like the stickiest, muddy swamp and like taking steps and feeling like I am barely getting anywhere. And after the 6 months, I did decide to end my relationship with my parents. But then now, for the last 9 years, I am still unpacking just how extensive and debilitating and how far-reaching my mom's abuse was. Like how deep into the depths of all of my thoughts her little like tentacles could reach into. And I keep finding new little bits and pieces here and there. Nothing is earth-shattering. Nothing is a groundbreaking breakthrough. It's just like, oh, here's another little grain of sand to add to the pile. Like, yeah, there it is. There's another one. I just made one little tiny little bit of progress again. And that's just like, it's not a breakthrough thing. It's like systematically undoing 30 years of narcissistic abuse. Like, it's probably not going to be undone in even 6 months of sessions, you know? Okay, carrying on with your responses to where you think this pressure comes from to have your clients have breakthroughs in session, the next most cited response was a desire to help. Somebody says, wanting to help a client as soon as possible. Totally understandable. Somebody says, I want to help. And somebody else says, ensuring that we are moving forward and progressing properly with time. Again, this brings me back to that comment I shared before about whether breakthroughs are an important part of progressing towards our goals. My fear or concern is that we've somehow conflated regular breakthroughs with our clients as sort of like that dopamine hit, maybe for our clients, but maybe for us as the therapist, that like, yes, I am doing good work with this client. I helped them get to another big breakthrough today. Like, good job, Marie. Good job, Marie. Like, you're helping this client. When really, like, the signs of whether you're helping a client have more to do with like, how comfortable do they feel living in their own skin? Or, you know, are they making reasonable, maybe marginal, but reasonable progression towards their end goals? And it may not have anything to do with breakthroughs. There may not be any major dopamine hits. It may just feel like, okay, and we're showing up again, and we're going to continue in the direction we were already going. Okay, and the other categories of responses folks had fewer responses in each category, so I'll list them out. Another category was a mix of internal and client expectations. So that was kind of interesting that 3 different people said, like, it's a little bit of me, a little bit from my client. And a couple of responses were in the family expectations category. So somebody said, I had a client whose wife made him switch to EMDR because of the lack of a big breakthrough. Ooh. And somebody else says, parents as I work with kids. Yeah, that tells me more about, I think, the family system than the role of therapy in helping, you know? A couple people said it was just from themselves. And then there was a whole list of like miscellaneous, it didn't necessarily fit in another category explanations. Somebody says insurance and the length of time I've seen someone. Somebody else says being a high achieving perfectionist. missing the micro progress, transference. If someone shares about their own therapy with friends, it's usually a breakthrough moment. Like, the list goes on and on. I think there's probably, like, we could probably keep going and rounding out like a lot of different sources of this pressure to have breakthroughs, which again may or may not have anything to do with client outcomes. But one thing that I'm wondering that's not backed by anything, I'm wondering, is if it's possible that the pressure to have breakthroughs is something that we carry, but that our clients, on average, in general, don't necessarily expect from us. Like, is it possible that we feel all this pressure, whether it's coming from inside ourselves, or we know how much money our clients are spending, or we saw it happen in media, and maybe there's one or two, certain clients that do have that expectation, that then we take it on and we put so much pressure on ourselves when maybe our clients are actually really happy with this reasonable pacing. Generally, learning how to do things takes one step at a time, consistency, practicing, rehearsing, and not one epic change. If anything, like a crash diet type of epic change tends to be unsustainable when we're talking about other areas of life. So I think most folks who are putting in the work can understand. I think, just guessing, that they can understand that that's how it works for therapy too. And another thought that I have too is, like, from an attachment-based perspective, like, are we needing to provide a breakthrough for our clients? Like, I think of, for example, if I wear my mom hat and I think about wanting to support my children as they grow and develop, like, I witness my children have breakthrough moments in their learning and development, and it's really rewarding, but I never feel responsible for them. It's always like, wow, you had a breakthrough. Like, even just like that moment when first, speaking of an individual being primed, my children 4 and 6 are primed to learn new things and learn them quickly. But like, I watched my 6-year-old watch another older kid at her summer camp make those little lanyard boondoggies, whatever they're called, things, and she just figured out how to make it, and she was so happy. And it was like for her, it was a breakthrough. Like, Mommy, I figured out. No one showed me. I just watched somebody do it one time, and she was like so proud of herself that she figured it out. And I was like, oh my gosh, she figured this out. And she's like, is that normal at this age? Like, I don't know, but like, wow, good job. Like, I did not feel responsible for that. Like, even if it had been me showing her and not some other kid at camp, like, it's not me showing her that gave her the breakthrough. It's just the environment allowed her breakthrough to happen that she was already primed for. And that's kind of, again, a silly example, but even for the breakthroughs that do happen, like, I don't feel that therapists are personally responsible. Like, we are responsible for setting up the best environment to support our clients. And if one person is primed and ready for a breakthrough, they will have it. But if somebody else's best growth looks like slow, marginal baby steps day by day, then the environment that we create for them will help set them up for that as well. And that just feels to me like a much more securely attached relationship between therapist and client, rather than like, oh, okay, like if I was the helicopter parent, or then I kind of like, okay, we got to teach you how to make these lanyards. You need a breakthrough. It's like, oh my gosh, that's a lot of pressure. And now, did we miss the point? Because my kid is just really happy to figure this out without me actually showing her, making it happen for her. And that wouldn't be as fun if we had to have the breakthrough. Like, you could follow that pretty deep. I'm sure it's not always that deep, but we could see how having pressure to have a breakthrough could actually at some point derail how therapeutic the environment is. And if we just said like, hey, we're ready for a breakthrough if it comes, I'm here for it. I will be happy for you as your therapist. I will be happy for you if you have a breakthrough here. We're just going to make it a safe place for whatever is needed to happen. I will walk with you. I will journey with you at your pace, whatever pace that is. Here we go. And it's going to be okay. Well, this episode, I feel like I was all over the place. I don't know why I got so worked up on this topic. If it's the topic or the fact that my dog has still been anxiously panting here under the desk the entire time that I've been sitting here. But it does seem that there's some shared interest in this topic just by how many of you responded to the polls that I put out. Thank you for those of you who did and engaged. And also, it's just fascinating to me that I don't necessarily find a bunch of information about this online. So if y'all are familiar with spaces where folks are talking about this in different, whether it's research or just chatting about it online, I'd be curious to hear. Share in the comments. But I hope this episode was still helpful and just engaging with the topic, getting you to think critically about how you approach therapy. Do you feel any pressure to have breakthroughs? What do you think about the idea of breakthroughs in therapy? Are breakthroughs necessary? Is the pressure to have a breakthrough helpful? Etc., etc., etc. And whatever you come to, I hope you are kind to yourself, give yourself grace and compassion. I think we live in a society that emphasizes quick change, magical changes with like a magic wand, more than is reasonable. So yeah, no reason to be hard on yourself for feeling that pressure because it's everywhere. And before we close, I'd like to thank TherapyNotes.com for sponsoring this video. TherapyNotes helps with all of your practice management needs, from scheduling to notes to billing. They have a HIPAA-secure telehealth platform and a whole suite of AI features to streamline your documentation process. If you'd like to check out TherapyNotes, you can get 2 months to try it for free, including all of their AI features, with no commitment, just by clicking the link in the description of this video. Well, thank you for joining me. I think I'm gonna take my dog on a walk or somewhere where there's no fence noise to edit this episode. Thanks for being patient with a more chill episode this week as well. And until next time, from one therapist to another, I wish you well. Do y'all want to see my dog? She's been in the same spot this whole time. Hello? Sobi, what do you think? Good job. Beautiful. Hi, Elsa. Are you here to support Sobi? Yes. You taking care of Sobi? Good.